My name is Marcia, and I have lymphedema. So when I went to see my primary care doctor, he had mentioned at one point that I have some swelling in my legs, which I knew about. But then he also, pushed on it, and he could tell that there was some pitting in the edema. My cats are playing with their toys, so if you hear some noise in the background, that's them playing around. Anyway, there can be many causes for edema. Sometimes it's an injury, so you might have swelling, something like that. Those are different types of swelling. Those are as a result of an injury. What I'm referring to is swelling as a result of insufficient flow in your lymphatic system. Quite often, this is something that can go for a very long time without being diagnosed, or not getting diagnosed until it's too late or later in the stages of the lymphedema cycle. When I asked my doctor about what I could do to treat the edema in my legs, or if there was any type of diagnosis or test that could be done to find out more about the swelling and edema that I had, he gave me a referral to go see a vascular specialist. That's what I'm going to do with you today. I'm going to take you along on my appointment and then go over with you the results of my initial appointment with the vascular specialist to let you know what the next steps or plans are in my treatment. So let's go see my vascular specialist. So when I first arrived at my vascular specialist, I check in at the reception desk, and then once they call me back for my appointment, the first thing they do is they take your weight, and then we go on to the treatment room. Once I get in the treatment room, there is a typical examination bed there, and then there's also a screen on the wall that has a mat in front of it. And that screen is where they took pictures of my legs from all sides. So I was undressed from the waist down, just with my underwear on, and they took pictures of my legs from all sides. So I actually met with a physician assistant, and she was super helpful and had a ton of information that she was able to share with me. And quite literally, just from looking at my legs, she was able to give me a diagnosis of what is going on. The edema in my legs, obviously potential causes of the lymphedema. So that's kind of what I want to go over now. A lot of times there is a misconception that lymphedema is part of your venous system, which it's not. It's not part of your veins. It is actually a part of your lymphatic system, which is connected to your immune system. So the lymph fluid, which is what causes, or the swelling that you get in your limbs, whether it's in your legs, arms, or neck, sometimes that fluid is made up of mostly proteins and white blood cells. The lymphatic system carries that fluid back up to your lymph nodes, where it is then filtered and put back into your bloodstream. So while it is connected to your veins and your bloodstream, it is a different system in your body. I've had swelling of some sort on my legs on and off for probably a better part of 10 years or more. I bought my first pair of compression socks about 10 years ago, and I've always struggled to find some that actually fit my legs properly. I thought it was something that I could just go into, a pharmacy, or to like even Walmart or Target or whatever, and just pick up a pair of compression socks and they would work great for the issue. It wasn't until this appointment that there are different types of compressions and a proper way to even measure to make sure that you're getting the right type of compression for the swelling and stuff that you're experiencing. After I talked with the physician assistant, I explained a lot of my history with her, and then she examined my legs, and I'll put in some footage here of my legs so that you guys can see as well. Either some pictures of the swelling that I've been experiencing, and then also some of the varicose veins that I have too, which I didn't know that they were varicose veins. Some of them are just like they look like little dots on my legs. Other ones are some puffy like veins that you can actually see the vein. I just thought that they were superficial veins, and I didn't really, I didn't think they were varicose veins or think that they were a problem. In addition to being diagnosed with the lymphedema, I've also been diagnosed with chronic venous insufficiency. So I don't know much about that yet. That's something that she actually has scheduled a follow-up. In a couple weeks, I'm going to go back and I'm going to have some diagnostic imaging done for my venous capacity to see. I believe the way she explained it is they're going to do some mapping of my veins, and that way they'll be able to identify some of the problem areas that I have with the venous issue. So again, the lymphatic system and the venous system, they're two different things. So I do have two separate diagnoses here. Then we talked about the causes. She started off by asking me if I ever had any sort of injury. When I was younger, I was at one point, I think I was about 15 or so at the time, I was kicked by a horse in my leg, and it was a pretty severe kick. It didn't break my bones. I was kicked in the thigh, but I have a horseshoe-shaped indent on my thigh. Most of my swelling occurred probably, gosh, 25 to 30 years after that injury. And that's the only real injury that I've had to my legs. So as we talked more, we did talk about my weight. And of course, my weight has been increasing pretty much since college. I've been yo-yo dieting most of my life. If you guys watched any of my previous videos, especially if you watched my I Am Morbidly Obese video, my entire history is there. So you can learn a lot about how my weight progressed over time. So again, gaining weight, losing weight, and then always gaining more, and now having been at my largest just a few months ago. And just the way the fat is distributed on my body, more than likely the cause of my lymphedema is because of my body weight, the size and shape of my body, the way the fat is distributed in my belly, and the way that fat is sitting on my thighs when I'm seated like this. Even when I'm walking, my belly still is on top of my thighs, and it's cutting off some of the flow for the lymph system and my venous system. So it is very likely that me being obese and continuing to get larger and not doing much to take care of drainage in my legs, stuff like that, it's most likely caused my condition to get much worse. Any condition or procedure that can damage your lymph nodes or the lymph vessels could cause lymphedema. So it may not be just because of weight, for instance, like mine is. So some of the other causes could be surgery, treatment of cancer or cancer itself, or any infections that you might get. Lymphedema is something that will never go away. Now it's only something that I'll be able to maintain some sort of treatment essentially for the rest of my life. So most of my swelling is in my lower legs. For me, these are some of the symptoms that I was experiencing. So some of my symptoms were swelling in my toes, swelling in my feet, and in my legs, like my calves, and just above my ankle. In fact, usually right above my ankle is where the most swelling occurs. Legs feeling very heavy or tight, and tightness, but what I mean by that is the skin can feel like it's very tight, like it's about to burst because there's so much pressure from the swelling in your legs. All that swelling can also reduce your range of motion. So when I was trying to like rotate my feet in a circle, stuff like that, I just didn't seem to have the same amount of flexibility as you would think you should have. I also had quite a bit of aching in my legs. The pain actually, when I would be laying down or reclined, for instance, on this couch, if one of the cats would jump into my lap, points where their paws would be standing on my legs because they're like essentially stabbing me in the leg with their paws, I would get sharp pains that would kind of shoot up my legs when they would stand on me. And I was diagnosed with type 1 or level 1. So the severity of mine is not that significant because I don't have the sores, like I don't have significant issues with sores or cuts healing. I don't have the fibrosis of my skin. I do have very chronic swelling though, and it can vary a lot. So one day the measurement of my calves could be 16 inches, and the next day, if I've had them elevated or been wearing my compression socks for a period of time, they could be down to 13 or 13 and a half inches. So I could lose 3 inches of fluid in my legs in just one day or a couple of days. So it is definitely something that should be treated, because it can progressively get worse and cause actual physical damage to your skin and your legs. So the PA, the physician assistant who saw me, she actually said, good job on me for actually seeking out treatment before it got to that point. This is why I encourage anyone, if you're having swelling in your legs, go talk to your doctor about it, see if they can give you that referral. I've been given a course of treatment, prescribed for me some compression socks, and these are specific type of compression socks designed for the treatment of the lymphedema and the chronic venous insufficiency. That's what I'm going to do next. In my next video, I will take you to the durable medical equipment place, which is local to me. So that way you guys can see the process of me getting prescribed socks. I've never had a prescription for socks before, but it's cool to know that it's something that they can do. Another thing that they did order for me was where they gave me a script for some leg pumps. So somebody should be contacting me in the next week or two, so that way they can come and fit me for some leg pumps. So that's where we are now. Thanks for joining me, and I hope to help you guys maybe learn a little bit more and why you should also pursue treatment yourself. My doctor didn't know enough about edema to do anything about it himself, which is why he gave me the referral to a specialist. So again, I do highly recommend you have this conversation with your primary care so they can give you the referral or recommendation you might need to go see a specialist about it. Again, this is something that is very underdiagnosed in people because most people don't ask about it, and most primary care doctors don't know about it. All right? So thanks so much for tuning in. I appreciate you all, and I look forward to seeing you in the next one.